Nosodes. The Greek word noso is a prefix which is added to give the idea of a disease indicated is morbid root. These remedies are prepared from the disease substances or products. After Hahnemann shortly published his chronic diseases theory, Hering performed the first proving of sorinum on himself. After that, nosodes come into act. What are nosodes? Homeopathic preparation made from pure morbial culture obtained from diseased tissue. Example: measles, anthrax, tuberculosis. Now, what are the importance of nosodes as an intercurrent remedy? Because nosodes are used as intercurrent remedies in the treatment of chronic diseases. This is the most common use of nosodes in homeopathic practice. Second is as a homeopathic prophylaxis. The first use of homeopathic remedy in prophylaxis was done by Hahnemann when he used the remedy belladonna as prophylaxis for scarlatina. Third is when the similar remedy stops working. While during the treatment of chronic disease, when similar remedy stops working, the use of nosode at this point in the healing process will remove the obstacle to cure and allow the similar remedy to continue the cure. Fourth one is when the remedy prepared from a disease part and are used during the treatment of disease, that is use of the parvo nosodes during the treatment of parvo. Fifth is they can be used as a constitutional remedy during the treatment of chronic diseases. What are the classification of nosodes? First is basic nosodes, and basic nosodes are sorinum, bacillinum, madorinum, carcinosin, syphilinum, tuberculinum. Next is exanthem nosodes or eruption on skin. They are pertussin, morbillinum, anthracinum, influenzinum, variolinum, diphtherinum, melandrium, parotidinum, vaccinum. Next is isopathic nosodes. They are pyrogen, staphylococcin, malaria officinalis, pneumococcin, streptococcin. Next is autogenous nosodes. These drugs prepared from the secretion of discharge from the pathological tissue or organs of the patient himself for the treatment of that disease, that is tautopathy. Now, intestinal or bowel nosodes. The bowel nosodes are a series of homeopathic remedies made from human intestinal flora, discovered and developed a distinct class of vaccines for the treatment of chronic disease. They were firstly proved by Dr. Edward Bach, Dr. Wheeler, and continued by John Patterson and his wife. There are 7 nosodes. There are 7 for him. These remedies were started knowing as Bach nosodes or the bowel nosodes. The nosodes are Proteus, Gretner, Ficalis alkali genus, Bacillus number 7, Morgan, coli mutable, and dysentery coli bacillinum. Important nosodes. They are well proven and lesser proven. Now, the main thing is indication of nosodes. The first one is as a constitutional remedy. These nosodes are only curative when they are administered by the totality of the symptoms. Second is when well-chosen remedy did not act. Third is lack of symptoms. Fourth is when there are 2 things that may happen after the ingestion of nosodes for the constitutions, bring the constitution towards a state of health. Fifth is never well since syndrome. Sixth is partial picture of constitutional remedy manifest. Yes, no one remedy completely fits the case. Seventh is the miasmatic intercurrent. This is frequently used nosodes type. Eighth is related to genus disease. Ninth is homeopathic prophylaxis. 10th is autonosodes. Contraindication of nosodes. Never use nosodes in the following conditions. These are in explosive state of miasm, during the active phase of recurrent attack, in the active phase of any acute disease, and last one is do not use tuberculinum in an established case of tuberculosis or in an infectious state. Sphere of action of nosodes are GIT gland, connective tissue, skin, muscles, respiratory system. Characteristic physical symptoms of nosodes are offensiveness, hemorrhage in chronic disease, marked tachycardia, cancerous condition, suppressed or ill treatment disease condition. All nosodes crave alcohol in any form. Remarkable action on glandular system, chronic catarrhal condition of the lungs, profuse perspiration with relief of symptoms. All nosodes are indicated whenever there is a family history. Obstinate constipation, rectum seems to be tied up with stricture. Next is trembling all over the body, intense nervousness and profound exhaustion. Potency of nosodes. Unsuccess even the educated homeopathy practices due to lack of knowledge of proper application of nosodes in that practice. The frequency of dose of nosodes can be decided only by clinical observation and experience. The higher the potency, the less frequent in the repetition.